Our next session is going to be the family directed assessment. Is it assessing or engaging? I'm going to be reading the bios for Katrina Bush and Marilyn Espe-Sherwindt, and she's going to be joining us on the screen today. Katrina, who holds a master's in education from the Ontario Institute for Studies in Education, University of Toronto, has worked at DODD on the EI team since 2001. She started out as an EI consultant and EI specialist, traveling with her regional colleagues from the Ohio Department of Health, which used to be the EI lead agency, Ohio Family and Children First, and the Family Information Network. Since her retirement from full-time work at DODD, she has worked on a number of projects, most recently the EI rule revisions. She, along with her many colleagues, will transition to the new Department of Children and Youth in January 2024. Next, we have Marilyn Espe-Sherwindt. Marilyn has spent her entire career in early intervention. Those of you who know her also know how much she loves this field. After retiring as the director of Family Child Learning Center at Akron Children's Hospital, she continued in her love for EI as a consultant for Ohio's Project Trees. Marilyn also is a consultant and trainer for the European Association on Early Childhood Intervention, especially in their work to support the development of EI systems in Eastern Europe and Central Asia. Today, if all goes well in cyberspace, Marilyn will be joining us from Moldova. And I will turn it over to Katrina.
Oh, does he know to have my slides up? He does. Or do I do it myself?
Well,
Right there. Okay, good.
He's going to have yours on there.
Okay,
And then this is going to be
perfect. Perfect. So do I need to tell him to bring mine up? There we go. Oh,
Is it working now?
try that. So this, okay. Okay, perfect. Tech help, always useful. So I'm going to just do a little bit of informational background, rule, boring stuff before we lead into Marilyn's and Project Trees and the OACB work around family-directed assessment. So as you know, probably in at least a general way, all state of Ohio rules have to be reviewed every 5 years. We are in that cycle now for early intervention. So we need to have any revisions or changes to our rules ready for implementation by July 1st, 2024. So for the last year, starting around late fall, early winter, this 2022 into early 2023, we've been soliciting stakeholder feedback. The Ohio Association of County Boards has been instrumental in going around to the regions across the state and getting feedback on rules and forms. Way back, I think they submitted those to us in December or January. And then we talked to all the consultants on our internal team who had been listening to you and taking notes and what didn't work on forms, what didn't work on rules, what there was confusion about. So we've been taking all of that, and then we started stakeholder groups in April and May to look at each one of the rules and the forms, and we've been going through that process. So Henry Matthews over here, one of the early intervention consultants, has been my partner in crime in rule informed development. So I'm thrilled to have him working with me on that. So that's where we're at, and the rules are very, very close to going out for clearance, and we should be able to get that to you pretty quickly. We're hoping in the next week or two, and you'll start being able to look at rules and forms. So when we talk about family assessment, in our current rule, you see that in the definition, assessment is what is defined, and then the child part and the family part is identified within that assessment, within that language in the definition. What with the new rule, the proposed edits to the rule we're looking at doing is breaking out child assessment and family assessment and making that clear which parts. So actually nothing is changing. We're proposing to call it assessment of the family and assessment of the child and not family directed assessment, because the field has become accustomed to equating both child assessment components and family assessment components within the rubric of family directed assessment. So we're hoping to clarify in this next rule what the assessment of the child entails, or what the definition is first, and what the definition of family assessment is. And you'll see there that not much has changed in terms of content of that definition. And there's no change in the purpose. So then in, I want to go back, I think. Oh. So in family assessment, this is what we currently have, family directed assessment. This is in the language for the procedures for how you conduct the family assessment. And you'll see here that it requires the department approved tool. So that you will see is what we're changing. We aren't calling it directed anymore, and we are removing the requirement for department approved. It's still voluntary. It's still based on information obtained through a tool and through interview, but the department will not ask to see those. So we will still look at IFSPs and outcomes, and we're looking for family outcomes and child outcomes. So that is just the background for what, because we know that that's been confusing and it continues to be confusing for the field. And I now want to kick it off to Marilyn, who will be talking about a very specific family-directed assessment work.
Thanks, Katrina. And I understand you're going to be advancing my slides. So do you want me to wave my hand, say next, please, Katrina? You let me know.
So hang on. We can see you, okay.
Can you hear me okay?
Now we can. Yeah.
Okay, I turned myself on. It's a long way between here and there. Maybe that's the problem.
We're good. We can hear you.
Okay, great. Okay. So I get to talk about thinking more about this family-directed assessment. And most of you know that I have been, and Susan and others in the room have really been around since the very beginning. You know, even when the first law came out back in 1986. And so I think as a field, we have struggled to figure out what the law really means, what the law is asking us to do, what's the intent, and is it possible to follow the law and still be engaging to families? Because today, you know, I was at a conference here in Moldova, and people from Portugal were here, and I was here, and the Moldovans have just passed their first early intervention law. And so it was really an interesting discussion about what the law can do in terms of adherence to quality standards and science and research, and kind of where the role of the law, and then the role of those of us who are practitioners and researchers and parents. So this comes actually from a wonderful article. This title, I was really inspired by a 2008 article, and I'll talk about it in a little bit. But it really does talk about this concept of the family-directed assessment, and can we both assess families and yet still engage families, especially during the first 45 days. So, Katrina? And it could be that when you change the slide, it might take a while for it to move from here. So Katrina has already talked about what's going on with the rules, family assessment versus child assessment. So I would like now to take us back to the federal definition from day one and what really is the federal law asking us to do and how. And then talk a little bit about why do these words, priorities, concerns, resources, why do they appear in the law? Because there's science behind the law, what the law is asking us to take a closer look at. We're going to explore a little bit about some of the challenges in assessing families. I think, like I said, for 30 years, we've been trying to figure out what is the intent of the law, and is there a way to do it in a way that still creates this partnership between us and families and really can put family in the driver's seat. This whole concept in the law of family directed, and what does that mean? And then we're going to talk a little bit about the Project Trees work with Lawrence and Delaware counties in terms of testing Charting the Life course, 2 tools from Charting the Life course as a strategy for engaging families in the family-directed assessment, now known as assessment of the family process. So that's where we're headed. Katrina, please. In case anybody wants to know where I am, I'm Waldo, and I'm here kind of in the middle of the screen. I don't know about you. Some of you are so young that you may have read the Waldo books. I was the parent reading those books to my children. But as you can see, Moldova is very small. It's part of Eastern Europe. Until I actually looked at the map, because I wasn't sure myself where I was headed last week. It's surrounded on 3 sides by Ukraine, which is very, very interesting. It is about the size of the state of Maryland, has 2.5 million people. I've been looking on Wikipedia before tonight. Well, it's tonight here, tonight's presentation. And it's actually the 2nd poorest country in Europe. But from my presence at the conference today, meeting people, speaking with people, doing a presentation, the country is very rich in human resources. And they really are motivated, excited to think about how to build a national early intervention system. And so they've passed an initial law, which I think they're going to go back and revise. What they have now across the country are 11 early childhood intervention centers. And so at this point in time, families still come to the centers. But the country is very interesting. These people who work in these centers are as passionate about early intervention as we are. And so they are really trying to forge a journey where they adopt not only the law, but quality standards and the contemporary models of early intervention. Okay, Katrina? The federal law is actually simple. It asks us to do 3 tasks. To figure out how do we help families describe to us their resources, their priorities, and their concerns related to enhancing the child's development. Nothing more, nothing less. But those are the 3 components that are part of the law. And the law also says, we have to really use quality interviewing techniques as part of this. And we have to think about choosing a tool or tools depending on what fits the family, theoretically. And so it has to be kind of more of a process, honestly, instead of an event. Right. So I think that's the intent behind the law. But I will tell you, having been there at the very beginning, there were many conversations right away about we don't want to think families to think that we're assessing them. We don't want to give them a score. That's not our job. Our job is to really listen and understand and have some kind of systematic way of gathering these 3 chunks of information. So these 3 chunks of information are actually based in all the research that's happened over the last 40 years in early intervention. So Katrina, if you would click. All right. And this one is hard for me to see because of so I'm going to read it from my paper because my camera and some of the Zoom paraphernalia gets in the way. So I'm hoping you can see the whole slide. So I want to start at the bottom, thinking about what is early intervention right now. Where have we been and where are we right now in terms of all the research? And so I think the contemporary definition that is used, we use it in our training in Europe all the time, is the different, and I have to read now from my paper, the different types of parenting supports provided by early childhood practitioners and other social network members. So again, it starts out as the family is the key, the supports that we provide to them along with their support system. And those supports, how do they provide parents the time, the energy, the knowledge, and the skills to engage their children in everyday child learning opportunities that promote and enhance both child and parent confidence and competence? All right. So thinking about necessary supports and services, and we're going to go around the circle. Supports and services aren't just us. It's this whole spectrum of the kinship network that the family has, who's in the immediate family, who are their relatives, the informal network, who are their friends and neighbors, who is there supporting them, what kind of resources do they provide back and forth. And then what's our role as the professionals? And we are part of that support network as well. But we also know from the research that actually the support from family and friends has a stronger influence on parent well-being than our support, but we're still a key piece of that support. It's just we operate in a different way. So what isn't in the law, but is still very much part of kind of this current vision, this current research, the 40 years, what do we know about what makes a difference? It's being strengths-based. And so even though strengths isn't listed per se in the law, I think it's implicit in the research and we have to think about it. So strengths are very simple. We don't go to families and say, well, what are your strengths? Because you'd ask me that and I couldn't tell you what my own strengths are. And families, it's kind of an awkward question. So really in the research, especially the research done by Carl Dunst, is the different kinds of family members' abilities and interests. And the key is all families have strengths. So abilities, how do family members procure their resources? Carl likes to use big words, procure resources and engage in activities that strengthen the child, the parent, and how they work together as a family. And interests, what do family members like to do individually and together? Then we move around the circle to resources. And really I'm going to read from my paper because the Zoom stuff is covering up the top of the slide. The full range of information, emotional support, instrumental assistance, experiences, opportunities, and so forth that are available from social network members for addressing and responding to family concerns and priorities. So we're really understanding what is life like for the family, especially since the birth of their child. Then the law talks about priorities and concerns. So priorities is very simply what the family believes to be highly important and deserving of attention. And then Carl defines concerns as the family's perceptions of a discrepancy or kind of this big gap between what is happening now and what is desired. So concerns, priorities, resources, strengths, and then conversations about how do we tie those all together in terms of, and I just lost the slides. How do we tie this all together in terms of the family assessment? Okay. Can I get back the slides? I've lost the screen. And can you guys still hear me?
Hello, this is Andrea, the captioner, and I can see you and hear you, but I also lost the conference.
Okay. Okay, so it wasn't me clicking buttons.
No, I think maybe, and your slides are coming through fine before.
Yes.
Maybe we should just hang on and see what happens.
That's what Susan is messaging now.
Okay, thank you.
They lost internet. Instrumental assistance was the last thing you said. It's looking promising. Yes, I'm still on.
Okay, We'll get started again.
Okay.
Thank you. Thank you. We shook our sillies out, I think, for a minute, and
Okay.
that's excellent.
So
And
the
Marilyn
last,
is back. Okay.
I am back. I never left, actually. So thinking about, Susan texted me that the last thing that I happened to be saying was instrumental assistance. So I think we were talking about resources. So again, resources isn't just about stuff. It's about support from the members of the family's network. It's about emotional support. It be, thinking about support from other families who have children with disabilities. So it's more than stuff. It's the bigger picture. It's really understanding who's there for the family. And then priorities, very simply, because the slides are back, what the family believes to be highly important and what they want to spend their time on, their attention on. And then finally, the family's perception, concerns. It's like this perception of, gosh, this isn't the way I would like it. I'm really worried about this because this isn't how I want it to be. And this is how I would like it to be. Okay, Katrina. So this is all science. It's not made up in the federal law. It's not made up in the EI rule. It's really science. So Katrina, apparently I left some animation in. So some of you may remember that about a year ago at the OACB Fall Conference, we did a session. Just keep clicking and I'll talk about everything. Just bring everything in. I brought up this concept about what happens between our visits. And I use Robin McWilliams' slide, which is in the upper left-hand corner. And that little black sliver, you see 7 circles for 7 days a week. And that black little sliver is the amount of time that we are there with the family. And so I've used that in that presentation and in presentations since that time is to really talk about the incredible amount of time that lapses between our visits. And again, Robin uses this to talk about, it's really the magic happens between our visits. You know, what happens is most critical and the consistent adults in the child's life. So I would like to think that this law, in terms of family assessment, assessing families, however it ends up, is really about understanding what's white in those circles. Who's in those circles? What are they doing? What is the family doing? Who is the support for the family when we're not there? How does the family spend their time? What do they like to do together? And so I think it's another way of looking at what the law is asking us to do. So Katrina, so it's our job to know what's happening in those 10,000 minutes between our visits. So again, early intervention, like 30, 40 years ago, we were talking about, child development and optimal development and blah, blah, blah. But it's really a family systems approach, thinking about not just the child, but the child in the context of the family, and then the family in the context of being out in the community. So here's what the research shows. What the law is asking for is needs, concerns, priorities, supports, resources, and strengths. All in the context of what we call family-centered practices. And so what, again, Carl Dunst has done is take a look at all his studies and think about what is the relationship when we use these practices, when we focus on family needs and concerns and priorities, when we understand the family's strengths, they tell us that, we discover those. And when we think about social supports and resources, what does the family need from us? And so what we see is that use of practices leads to stronger outcomes. So 4 of those outcomes that he's identified by using these practices, by focusing on what the law is asking us to do, take a look at, is families are increasingly engaged in involving their child in everyday learning activities, opportunities. Increased involvement in their child's early intervention program, engagement. Less caregiving burden. And what he means by that is stress, just the stress of being a parent, the added stressors that having a child with a disability may add. And then ultimately, which is really our goal, is more positive parenting confidence and competence beliefs. So again, I say this because there's a reason that the law asks for these things. It's science, it's evidence-based, it leads to stronger outcomes for both children and families if we pay attention to what the law is asking us to gather during our family assessment. So Katrina, if you would go on. So, you know, we've been talking about this for 40 years, and people have been concerned all along about, well, what do we mean by family assessment? And does it mean we test families? No, we don't want families to think that we're testing them. We don't want them to think that we're being intrusive. So again, this wonderful article written by Julianne Woods and Dave Lindemann back in 2008 addresses or raises some of the challenges. And I know that you have experienced one or all of these challenges. So the pressure of timelines. Now, from the very beginning, the 45 days has been intended to protect families, to prevent waiting lists, to make sure that we can intervene early intervention. But we also know that first 45 days has a lot of requirements in it. And so as referrals increase, as we might have staff turnover, it's like, I got to get it done. I got to get it done. I got to check those boxes and get it done. Paperwork and signatures from the moment we meet the family. Again, because thinking about how do we engage the family and at the same time that we're gathering information. And that can be a challenge, asking families to sign so many forms that may be needed. It's the reality. Communication among team members, especially I think now as our resources are stretched. So, you know, the service coordinator may go out on a home visit by herself. Then there may be 2 evaluators that go out by themselves. They may be contractors. They may be part of the ongoing team. Then there are other people involved. And so how do you communicate all this information that we're gathering about the child and about the family? I know I've heard people talk about this trying to build rapport at the same time we're asking a lot of questions and signing forms, because we all understand that our relationship with families is really where things happen. That is our goal, is this ultimate relationship that we can build with families. But that's also complicated by parents not understanding EI. You know, they come in, they may never have heard of it, you know, and then we switch to using jargon and routines and natural environments and family-directed assessment. And so again, that can sometimes lead to confusion, can lead to kind of a wall between us and families. And I think ultimately we have the opportunity always to think about, in these first 45 days especially, how much information do we really need? All right. We need priorities, concerns, resources, necessary supports and services. Science would say we also need to think about strengths. But how deep do we have to go in those first 45 days? Because what the law is really asking us to do is figure out how the family sees these things. Okay, Katrina, go on. Thank you. Sorry. So, you know, lots of people, you know, we kind of struggle with that word assessment. And I think from the very beginning, 40 years ago, when we first started talking, the passed law, assessment, we really weren't comfortable with using the word assessment, especially with families. And so I went and looked at just kind of some definitions of assessment. And this actually is from a chapter on child assessment in a textbook written in 2016. But I think it applies to families, excuse me. Because I think this is what the law is asking us to do. All right. What is assessment? The systematic collection and evaluation of information to determine what, if anything, based on what families tell us, to do differently. Very simple. Assessment doesn't necessarily mean we have to have scores or a test or anything like that. What we're doing is gathering information to figure out what to do next. Katrina? All right. I'm sorry. I've been talking all day. So going back to the beginning, and I know I really sound like, who is this kind of antique old person talking about family assessment? But Don Bailey was one of those first people. He was a parent of a child with a disability, wonderful researcher, has contributed so much to our field. But he has a child with a disability. And so at that time, there were many parents at the table as we were figuring out the law, what it means, what are best practices around the development of the IFSP. And so he wrote a great article. And by the way, I can send anybody the Woods and Lindemann article. I can send you Don Bailey's article if anybody's interested. So what is family assessment? All right. I love this. 1991. The ongoing and interactive process by which professionals gather information in order to determine family priorities for goals and services. According to this definition, and this is his, family assessment is a continuous process involving both family members and professionals. The primary goal is for professionals to understand what families want for themselves and for their children, and what they need from professionals in order to achieve those aspirations. I love this quote. I love this quote. Katrina, go on. And it's consistent with the law. So I think that when I read Don's words, when I look at some of the early materials, when I read the Woods and Lindemann article, I think there are 4 key words that we need to pull from that. Ongoing. Family assessment is ongoing. And to be quite honest, it starts the moment you meet a family. So even just in those first conversations that the service coordinator might be having in the family's home, she's already starting, or he is already starting to gather information to collect, to decide what, if anything, is needed. It's interactive. It needs to be, and this I think is the point of the feds using family directed. It's not something we do to families. It's a conversation back and forth as we gather this information. It's very interactive, engaging with families. It's a process. It's not an event. It's something that happens all the time. And our goal is always understanding what life is like for this family and what they hope to accomplish, what they'd like to happen during their time in early intervention. So, okay, enough of the boring science. Let's talk about just a couple of counties that have really been exploring this concept of assessment versus engagement. And so, from our introduction, you all know that I've been part of Project Trees with Susan and Beth and Ronnie and Janet, and our contract ended at the end of June. And in this last iteration of the contract, we had been asked to move ahead with 3 major priorities. And the first one was continuing to use the IDEAS framework in terms of improvement science, quality improvement. And we worked with counties around the state. And if you are in the audience today, and I'm sure you are, I want to thank you because we just enjoyed so much our work with you. And you did some great things. The third priority that was given to us by the department was based on their interest there was lots of charting the life course training going on at the time statewide. And so could this work in early intervention? So they really kind of gave us permission to do a little experimenting, to think about how we might want to use these tools and weave them into the flow of EI. And actually in the first Project Trees, we had Miami County who was testing the tools at time of transition. So if you want to go on, Katrina, please. So you've all heard us talk several times about the IDEAS framework. It's improvement in science. What you do is kind of identify a challenge, something you'd like to make even better. It can be great, but I want to make it even better. And you really kind of dig a little deeper and come up with a plan. And meanwhile, as you are implementing your plan, you're learning, you're evaluating, you're looking at data, you're not waiting 6 months, you're really making small tweaks all along as you're testing this. And a key piece of the ideas framework is called a theory of change. And that's really kind of your plan, your mission. What is it that you want to do in this improvement framework? So I'd like to share with you Lawrence County. So Lawrence and Delaware agreed to test this with us. And we have Lawrence's up here, and we're going to talk a little bit about what they've learned so far. And so again, we had blessing from the state, even though charting the life course was not an approved tool at the time. We had a blessing to say, yes, go ahead and try it, because we're really interested. Will it fit? Could it be of potential use in the flow of early intervention? So thank you, Katrina. You wanted to go on? So this is Lawrence County's theory of change. And you can see that at the bottom, eventually we got to the point of their priority was using charting the life course materials with families, their tool, not ours. So they were taking very seriously the language of family directed. And so in the theory of change, we start by planning outcomes. Short-term outcomes are in the middle. How could this help families? So again, Lawrence identified it would help them communicate. It would help them be prepared for meetings. It would focus on the cans, because they had had some training already in charting the life course, what my child can do, what we can do as a family, and it could increase their advocacy skills. And for the EI team, they thought, oh, this could be great because it will transition with the child. It's really the families charting the life course. I mean, we'll have copies and we can put it on the IFSP. It fits beautifully, but it really is family directed and it belongs to the family. But it's going to give us useful information. And Lawrence County thought, could it strengthen the relationship between provider and the parent? And then long-term, families would become stronger advocates. They'd have this information to take the next setting. It would increase their sense of control, give them a stronger voice. And Lawrence County, we laughed at this. They said, well, we'll be pioneers. That would be a long-term outcome. But again, they were looking at more participation from families, especially in those first 45 days, and giving families something useful. Give them, us as professionals, more confidence that families leaving EI will be okay. But I love this last bullet point that they came up with. Helps us focus on what is important to families. That is the law. That is the science. So again, what we see on the left is their strategies for proceeding. And if you want to move ahead, Katrina, in the interest of time, because we lost a little time with our tech challenges. So one of the things that we did, Lawrence County decided to use two tools, the integrated support star, and then really kind of the personal profile. Tell me about your child. And so, oh, darn, those S's should be moved over. Darn, that was just something that happened in cyberspace somewhere. So what we did to support Lawrence and Delaware was, first of all, to develop what we called a crosswalk. So we developed this big chart about kind of the components that are required in the law, the definitions, and where they might go, or where they might go on here on the Charting the Life course tools, and also where they then might fit on the FDA page, or that page on the IFSP. We also developed kind of a very draft introductory script for them to use, and Lawrence, I know, used it pretty verbatim, as well as an additional open-ended questions to help facilitate the discussion. Okay, so Katrina, could you move on? So Lawrence County could not be here in person today. So we sent them a series of questions, and we are going to be their voice today. So here are some of the questions we asked. So what led your team to being interested in doing something different? So Lawrence County was approached by trees asking us, and these are their words, asking us to consider using charting the life course in a micro trial. We decided to test charting the life course to improve our FDA process. We were excited about this. They were ambivalent about continuing to use the RBI. Why did you land on charting the life course? Well, they had some training already, unrelated to early intervention or us. We felt it was the most family inclusive and easiest to implement with the family. And so how are you implementing? Who, when, which tools? And again, I want to say that Lawrence is a small county. They don't have hundreds of families that they've tested this with. So I think they are, and that's the point of improvement science, is testing and trying. All right. You don't have to be perfect. You're going to test and try and figure out what works. So this is what they told us at the initial home visit while going over the forms. The service coordinator gives the family a brief overview of the integrated STAR and one-page description. If the child qualifies, all right, the service coordinator and DS will complete the integrated STAR and one-page description with the family in conjunction with the FDA. And in some conversations that we've had, they are thinking about, do we leave it with the family? Do we bring it to the family? Who completes the form? So again, they're testing all these strategies because they want to figure out, can we use this as a way to gather what we need, but also to engage the family and help them feel that they're in control of this process. So what have you learned? We've learned that it is more inclusive for the family and less intrusive in their daily lives. It's also simplified the process and allowed the family to be more engaged in the process. Katrina, if you want to go on to the next slide, just a few more. We asked them more questions to talk about today. Impact on families. It helps them to see their child in a more positive light, helps them to focus on the good qualities, and helps the parents and IFSP team to focus more on the child's abilities rather than their disability. Impact on staff. It has dramatically cut down the time spent on the family-directed assessment and has helped the IFSP team in that the family is more engaged. More family outcomes? Absolutely, from their perspective. And how does this compare to what you were using previously? We were previously using the RBI. It was just a series of yes or no questions, basically capturing the child's schedule. With charting the life course, it has increased family engagement. This is very important. As the plan is an individualized family service plan, we are able to focus on the family more as a whole. And this was a direct quote from them. Using charting the life course has been a game changer for us. So Katrina, if you'd go on. And just, we also we'd had many conversations with Lawrence, and we put these bullets in our final report to DODD. And I just want us to look at the three in bold, because the Lawrence County themselves have covered all the other points in their responses to us. The process promotes the use of flexibility, open-ended questions, and active listening on the part of the team. The information transfers easily to the FDA page of the IFSP. The conversational and strengths-based approach facilitates the development of a warm and trusting relationship with the families. Katrina, if you want to go on. So just a final quote from the Woods and Lindemann article, which I think is just always food for thought. It continues I don't want to say concerns we've had from the very beginning about the terminology of family assessment and what is family assessment, and does it mean scores and things like that. So this is one of their closing quotes in this article. Service providers with multiple strategies for gathering and giving information with families are better prepared to address the diverse learning styles and interests of families and caregivers. Following a strict protocol or documentation process may result in completion of the assessment process and compliance in specified timelines, but it may also limit the opportunities to gather important information and offer informational supports to the family. This interactive process of back and forth, these conversations, we're helping families understand early intervention while we're trying to understand them. Efficiency without effectiveness is not a benefit to the program, providers, family members, or the child. Katrina, next slide. Thank you. And with this, I'm going to sign. I'm going to turn off my camera and mute myself and turn it over to Susan for the rest of the session. But thank you guys. Sending you a big hug from across the Atlantic.
Thank you, Marilyn. You can leave your camera on. It feels good to see you. You're welcome to leave your camera on.
Well, for sure, I'll mute myself.
So one of the other counties that went on this journey with us to do a micro trial was Delaware County. And we thank them for being curious and being willing to give it a try. In the time that we have left, Delaware would like to share a story. And Deborah Lee, a developmental specialist with Delaware, is going to share a story.
Hi, everyone. This is a pretty outlying situation that I found myself in to work through using the RBI and the Charting the Life course. And I don't know that even everybody will encounter a situation like this in your career, but I did, and this is what happened. The family of this little guy, he was born, he started out with seizures, and seizures led to some brain damage, hearing loss, vision loss, and then a tumor, a rapid growing tumor diagnosis. So they were doing lots of things for him for quite a few months. And then it started to be doing things to him. And, as you know, at Nationwide Children's Hospital or in any medical place, they start to talk to families about, now we're doing things to your child rather than for him. And so at about 8 months, they started to have that conversation. By 9 months, 10 months, they started to accept the fact that Nationwide Children's Hospital was not going to do any more for him because it was really aggressive in a way that was not going to give more life, give more quality, give more anything really. So it took them each parent a little time to get to a place of acceptance. Dad was first, mom was much later, but by age 1, they were planning his birthday party and his funeral. And so they were at a place where they were together on that. So then it comes to me and our team to do an RBI. It was a redetermination, which sounds really silly. So it was a redetermination. And so we needed to do something to assess how this little guy is faring. And I didn't want to at all. I didn't want to use the RBI. I didn't want to use anything, honestly. I just wanted to let them live their life out with this little guy. And as I was thinking about this, I just found out a little while ago that I was going to talk about this. So part of what I've found out about this work and doing this process is as a provider using coaching strategies that it's been awesome to learn and grow and have the joy of knowing parents and working with families. But it's also the most difficult part as well, because I know the family. And so when this happens, it's almost less about the child. It's more about being in relationship with this family. So I think that's why it's difficult to tell the story more than it is. He's a sweetheart, but I think it's the whole picture that we enter into. So anyways, I also wanted to be very clear to the person who was going to be with me, because we needed a second provider, that like I was protective, like I felt protective. And I just wanted them to know that this was going to be a conversation that evolved and that came forth from the family, that I wasn't going to use all the bullet points that we have nice strategically placed on our template with the RBI. Nor could I use all the templates that's been available to us for charting the life, because some of it just wouldn't work, So I read through everything. I looked at all the different examples of charting the life. And so I wrote a few questions. And as I finished those, I went back to the top of the page and I just wrote the question, who loves baby E? And so that's how I opened it. They knew the process because they had another son. And so I said, so let's just talk about who loves baby E. And the mom just said, everybody who meets him. And that just started this journey that they shared about the people who love him and how that has changed. He has a brother that interacts with him a lot more. Dad was able to talk about the things that he used to do and actually grieve in those moments of conversation that now he doesn't respond that way. So now he just lays next to him. So it was something that I didn't really expect to be the way that it was, but it allowed them to tell a story about how things have changed in their routines and where they go and what they can do together as a family. And it was really gut-wrenching in a sense, but it was really beautiful at the same time. So I just let them, I just kept asking some of the questions about what's meaningful, and it really just evolved. And I look at what was written for me while we had the conversation, and I feel like I need to capture that somehow to give them. I don't know when, I don't know how much longer they're going to have with him, but so I don't want to, so anyways, I'll just sit on that for a while.
Thank you, Deborah. I really appreciate that. So let's see, we've got like 3 minutes. Any quick questions that anyone would like to ask, either about the rule change or charting the life course? Now, we've presented on charting the life course and using it in early intervention in past conferences, and we have a lot of resources to share with you about that, and we can maybe add some of that to the link at the end of this PowerPoint.
Any questions? Also, as I mentioned last session, this material will be available on Member Connect. And if anyone has trouble accessing that, please reach out to me and I will do my best to help you navigate that.